It's Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of my clients, James, and the question in the last episode was what they don't tell you in intensive care when it comes to weaning from tracheostomy and ventilation. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to continue answering the next question from my client, James, and his sister, Christine, regarding their dad in ICU who's had a hemorrhagic stroke. James and Christine's dad had a brain decompression where they evacuated a large bleed from his brain after the hemorrhagic stroke. James and his sister, Christine, and their dad were getting their dad in one of the best hospitals in the United States, the Cleveland Clinic in Ohio. In the meantime, his dad was getting a tracheostomy because he couldn't be weaned off the ventilator and the breathing tube. He also had ongoing seizures due to the stroke, and his anti-seizure medications needed to be optimized so he could wake up and progress to a neurology rehabilitation. So in today's episode of Your Questions Answered, I'm talking to James' sister, Christine, who also had questions regarding her dad's situation, especially with a view of the Cleveland Clinic wanting to move her dad to an LTAC, again, stands for long-term acute care facility. Christine wants to know what's the best course of action. So today's consulting and advocacy session is another excerpt from a one-on-one phone and email consulting and advocacy session with me. And the topic this week is part of this one-on-one consulting and advocacy session with me and one of my clients, Christine, is why you should avoid LTAC or subacute care when your loved one is critically ill in intensive care and ventilated. So to give you a bit more background, James and his sister, Christine, contacted me last year in August, and him and his family were facing a massive challenge. His dad, in his early 70s, had a hemorrhagic stroke, and he therefore had a massive bleed in his brain. When James and Christine first contacted me, his dad had already spent a few weeks in intensive care and already had a tracheostomy because he needed long-term ventilation in ICU. Furthermore, James and Christine's dad wasn't waking up due to the increased seizure medication he was getting as part of his condition. As part of his condition was that he had frequent seizures to begin with. To make matters worse, besides the stroke, the seizure activity and the long-term ventilation, the ICU was adamant to send his dad out of ICU into long-term acute care. And if you have followed my consulting and advocacy for any length of time, you would know that I strictly advise against LTAC or subacute care. The reason for that is simply that I can't tell you how many people contact us in desperation when they have a loved one in LTAC and they want to get them back into ICU. LTACs are a disaster at the best of times, and anybody with a ventilator and tracheostomy needs to be in intensive care or at home with a service like intensive care at home. Cutting to the chase, in this series of one-on-one consulting and advocacy sessions with my client James and his sister Christine, I can show them how to keep their dad in ICU against the hospital's wishes, and I can show James and his sister how they can negotiate best care and treatment for their dad, including getting him off the ventilator and the tracheostomy, as well as managing the seizures. So enjoy today's consulting and advocacy session and use it to your advantage. And if you are watching this on YouTube, just click on the link below this video and it'll get you to our website where you can read today's consulting and advocacy session that we transcribed for you between Christine and myself. Also, watch out for the next consulting session with James in the next episode of Your Questions Answered next week. See you then. And also, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly once your loved one is critically ill in intensive care? Well, you get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast once your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know once your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. Or you can call me, find international phone numbers on the top of the website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the consulting tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.